For years now, concussion has been the invisible injury. There are sometimes no broken bones or cuts or any visible signs of a concussion, so it has gone unrecognizable for many years.
I got my first concussion fall of sophomore year during a spring AAU showcase in front of college coaches, and I made the mistake of thinking I was okay and going back into the game and not only finishing that first game, but playing the whole next two games that day because I felt the pressure of my team and my coach.
The magnitude of contact doesn't always correlate well with the severity of injury. Most of the time, it doesn't correlate well at all, in fact. If we think about how people recognize concussion, we're usually looking for the big hit, the big contact, but it's not always that way. Oftentimes it's an incidental injury, it's contact on the line or in the interior of the line where you can't even see the injury. So magnitude of force is not a very good corollary. And when we talk about recognition of concussion, it's not always the big hit that correlates with the severity.
Dizziness,
Nauseousness,
Head pressure,
headache,
feeling foggy,
sensitivity to noise,
tunnel vision,
blurry vision.
difficulty concentrating.
Helmets don't prevent concussion. Helmets prevent skull fracture and bleed, and in the sport of American football, they do a nice job of that. But if you think about the brain inside the skull moving, and there's a hit, and then the brain moves within the skull and then comes back, whether it's a straight forward linear acceleration or a rotational one, oftentimes you can't, a helmet's not going to prevent that. From that, on the sideline, there are certainly times when you're going to want to transport an athlete right away. So an athlete that has significant loss of consciousness, if they have worsening symptoms, if they have, if they have deterioration of their mental status, and they're getting worse instead of better, then those are the ones that you're transporting to an emergency room just to make sure that they don't have a bleed or a skull fracture or a more severe injury.
Concussion was definitely the hardest thing I've ever had to go through as an athlete. Not only did it hurt me physically, it really hurt me emotionally. And they're just such important things to deal with. It's your brain, and that's the most important part of your body.
A common question is who's qualified to take care of concussion. Athletic trainers have phenomenal training and education in terms of concussion. Primary care sports medicine physicians that have been fellowship trained also have phenomenal training in concussion because it's such a common injury in sport.
During the first quarter of my art game against Clifton, I started feeling the first symptoms of the concussion, but yet I continued to play throughout the game and throughout the quarter, and eventually came out of the game with about 5 minutes left in the game. And I particularly think it's important to identify concussions early, because if I had come out of the game earlier, maybe I would have had a shorter concussion.
Keep in mind that if a kid is complaining, it doesn't always have to be after the big hit. It can be several minutes after. It can be, a hit in the first quarter and they're feeling symptoms in the fourth quarter.
The long-term effects really are more related to someone that has persistent symptoms, persistent difficulties. Eventually, post-concussion syndrome is pretty common as a long-term sequela. There's more recently in the press been concerns for the long-term effects of repetitive trauma, not necessarily repetitive concussion, as it relates to chronic and traumatic encephalopathy, which has been reported in football players and other athletes as well.
I was going to make a tackle and someone just crack back blocked me. It's I just went out. And so after that,
I had a lot of tunnel vision, and I couldn't remember anything.
In my own experience, I remember being in college and having had several concussions, having difficulty with academics, having difficulty performing on the field, and nobody really understanding why that was. It's come full circle. We're starting to understand that by putting kids in a situation where they're going to have repeated head injury, it can affect everything from their social interactions to their academic performance and even their ability to perform on the field. So when we have complaints such as headache, dizziness, loss of balance, those things need to be taken very seriously, and those kids need to be protected until they're evaluated.
So it's very important to just know your athletes, and if you see any behavior that's out of the ordinary to you, to get the child evaluated by a healthcare professional and make sure that they're okay. And it's better to be safe than sorry.